Hey KPal7, so I saw your video and I figured I'd throw out some facts in regards to Canada's healthcare system. Each province differs a little bit in regards to our healthcare. So here in Alberta we have something called Alberta Healthcare, and it covers a vast majority of our needs. And this is going to be a part one because I do want to cover a lot of ground with this because it's something that people need to be aware of. There is advantages, there is disadvantages, but more advantages, I would say. So first, for our Alberta healthcare, we have routine examinations by your physician, general emergency surgeries, emergency dental and oral surgeries, essentials in hospital care, diagnostic services like x-rays, lab tests, result interpretation. Generally with that, you can get in right quick. Can't really tell you how many times I've broken bones that I've went into the emergency and I basically went in straight away. There is standard room hospital accommodation as well. Things that will not be covered are prescription drugs, routine dental services, prescription eyewear, emergency medical expenses when traveling abroad, registered specialists and therapists. Nah. Hey KPal7, so this is another video in regards to healthcare here in Canada. In regards to how long of waits in the ER, it can range on the urgency, so you have to be sure, like if you're going to go in, it has to be urgent, and they will diagnose you right away. In regards to how long you have to wait for life-saving surgeries, that depends, because as good as healthcare is in Canada, we still have a shortage of doctors all across the country, and we need more specialists. And a lot of Canadian doctors, I'm pretty sure they get more training in the States, so we bring in a lot of doctors that are from other foreign countries as well. Elective surgeries, I'm pretty sure there would be a pretty extensive waiting list. When I was 12, I knew a guy who needed a heart transplant, and they weren't sure if they were going to be able to find a donor, but they did. And his life was saved in regards to that. And it was covered. For general practitioners, you can walk into any clinic and be in there within 1 to 2 hours. You can also book appointments. The cost of medicine can be really pricey and plastic surgeries are not covered, but you can get funding. Hey KPal7, so in regards to this video, I'm going to talk a little bit about the facts of the cost, the pricing of everything, and other personal things. 11.5% of Canada's gross domestic product is used for healthcare for that year. Canada's per capita spending ranks it among the most expensive healthcare systems in the OECD, and for those that don't know, it's the Organization for Economic Cooperation and Development. 85.2% of Canadians prefer the healthcare system. On average, a Canadian spends $6,604 in taxes for healthcare coverage. It's also important to note that that number changes depending on income. So if you make $127,000 in a year, you have 2 kids, you're spending about $12,000 a year. Although it's not tied to your job or dependent only on your income, rich and poor are in the same system and enjoy equal access. Now some of the personal stuff. With the shortage of specialists, we don't always know what's going on. My dad's back is deteriorating and he also has heart issues. And as of right now, he hasn't seen a specialist. He's seen doctors multiple times, but it's been a year and a half. And this is going to be my last part in regards to healthcare in Canada at KPal7. This is based on my personal beliefs, and I consider healthcare a basic human right. In regards to human life, all people have a right to healthcare at their disposal. The amount we pay is beneficial to all Canadians, even if the high-income earners are subjected to higher taxes. I think the strong should take care of the weak because it's a noble cause. But I think in regards to some of the socialistic systems that we have, I think some people abuse that system and more precautions should be taken for the people that decide to do so. Also, you may seek private healthcare if you wish, but it will have to be covered by yourself. Also, I think it's a safe fallback for anyone that could be struggling. You're not going to have to fork out tons of money to get the help that you need. There are even high income earners that don't know how to manage their money. So like I said, this is beneficial to all Canadians. And while no healthcare system is perfect, it gives us a great advantage.